Hello, and thank you for joining us on today's webinar entitled The State of Patient Privacy Monitoring and Its Future. This is part one, a Compliance and Privacy Officer's Perspective. My name is Shane Whitlatch, and I'm the Executive Vice President of Customer Value Creation at FairWarning, and I will be your host for today's session. Before we begin the webinar, I'd like to cover a few housekeeping items, and if you've been with us for several years, I'm sure you've heard this before. We are broadcasting this through WebEx, and the audio is optimized to be heard through your computer speakers or through a headset. If you are encountering sound quality or volume issues and need to join the teleconference, the dial-in information can be found on the Info tab at the top left of your screen, or you can click the phone icon that should be on the right menu bar. We should have some time at the conclusion of today's presentation for a question and answer session, and I encourage you to submit your questions as they come up so they can be placed into the queue for response. To submit a question, simply type them into the Q&A module that appears on the right side of your screen. We are recording this webinar, and a follow-up email is scheduled to be sent to you within 24 hours of the conclusion of today's webinar, and it'll include a link to the replay as well as all of the materials presented. Additionally, the same information will be posted on our website at www.fairwarning.com. Now I'd like to introduce the moderators who are joining us for today's webinar. As you can see on the screen, we're going to be joined today by the founder and CEO of FairWarning, Mr. Kurt Long, as well as the manager of the FairWarning Customer Success Team, Mr. Brian Stone. And before we get to the agenda, I'd like to turn it over for a moment to Mr. Kurt Long, the founder and CEO of FairWarning.
Thank you, Shane. And I want to thank in advance the guest speakers that we have today. We have many of them to share their stories of how they influenced privacy and expanded patient trust. But I try to always bring things back to what it's really all about here at FairWarning, and that's the idea we envision a healthcare industry. And when that we is an inclusive we, it's not just FairWarning at all. It's the vendors that we work with, it's our customers, it's everybody in the ecosystem. I hope the federal government, the state government, I hope all of us have the same vision, and that's a healthcare industry in which patients confidently share their most sensitive medical details to receive the best care possible without regard to privacy concerns. And survey after survey, both in the U.S. and around the world, it's been demonstrated very clearly that a patient's belief about that institution or that care provider's reputation for privacy does indeed influence what they will or will not share. So I just wanted to bring us all back to what I think we all have in common about for our patients' sake. So let's move forward. And then one more slide for myself, and that is we've always had the same vision, but I would say that 3 years ago we really looked out with our customers. We looked into the industry and tried to identify what the obstacles were to fulfilling on that vision, at least from a patient privacy monitoring point of view. Clearly, there's other issues in industry other than patient privacy monitoring, but for what FairWarning could influence, we felt like the availability of audit data from electronic health record vendors as well as healthcare application vendors was lacking. And while there's still much work to be done, our customers in the FairWarning Ready program together with us have now added support for every major EHR vendor so that it's compatible with patient privacy monitoring, as well as many dozens of healthcare applications. Jerry Burgess from Alexion Ascension Health will speak more specifically on this topic tomorrow, which has more of an IT and information security bent to that webinar, but I encourage you to listen to Jerry's perspective because it's leaders like him that have made a difference in getting data more available for all of us to use. Benchmarking is was also a very difficult challenge for the industry and for our customers. I think we all know that both at a state and federal level, there's broad guidelines on privacy, there's broad guidelines on what might be interpreted as user activity monitoring or patient privacy monitoring, but I think we also all know that there's no detailed certifications that give prescriptive guidance to a healthcare provider and, quite frankly, to BAAs like us who are looking to be best of class. We don't want to be audited and be found to either lacking or beneath our peers, and neither do our customers. Today, benchmarking is commonplace. We've made a big investment in putting the data together for our customers so that they could compare themselves to their peers by size and by type. The other lack, and this is still a challenge today, the expertise, that third bullet. We also looked out and saw that expertise was a big inhibitor, that no matter what the technology did, that if you didn't have the right people in place to run that technology, and it's a little challenging because for patient privacy monitoring, you have to have an inquisitive mind, you have to have discipline and analytic, but you also have to understand clinical workflow and clinical data. So it's not as easy as many have thought, but we rolled out fair warning ready certified training, and today there's over 200. And then finally, for those institutions that couldn't at all staff those kinds of professionals or retain them, we did introduce managed privacy services. And this isn't so much meant to be some commercial for fair warning as it is a vision for the industry, and in the stories that we're going to hear today, I'm most excited that they fit within the context of the initiatives and investments that we made as a company 3 years ago. So Shane, I'm going to turn it back over to you.
Great, thank you, Kurt. And so as you can see from the agenda slide, there are three main topics that our experts are going to cover today. And I won't go into detail. We're going to let our experts present that in today's webinar, but you can see expanding trust with patients is we're going to lead off with. We have experts that are going to talk about ethics and integrity. And then finally, we're going to end with some news around the Privacy Excellence Awards that many of you may be familiar with from last year. So as you can see, we are loaded as far as experts in both part one, which is today's webinar, and part two tomorrow. That'll be focused more on IT and IT security. And we're honored to have so many experts from the Fair Warning customer community join us today. And I'm going to let our moderators provide more detail into the speakers, to the experts as they come up today. But you can see we're well represented across the country from organizations both small and large, and we have experts from Banner Health, Beaumont, Mari, Susquehanna, Peace Health, and St. Dominic's, et cetera. But again, we'll go into much more detail. But again, we're honored to have so many experts from our Fair Warning customer community join us today. But we have a lot to cover, not a whole lot of time, so let's go ahead and get started. And let me bring back on Kurt Long and specifically Brian Stone to introduce our first speaker.
Yeah, thank you, Shane, and hello, everybody. Like Shane mentioned, we're really lucky to have such a wide variety of customer panelists joining today's call, and each one of the customer panelists will have an opportunity to share their own unique perspective on protecting patient privacy and how that's helped with expanding the trust with their patients. For me personally, hearing the stories about protecting privacy and how that's changing the lives of patients as well as many employees is probably one of the most exciting and enjoyable parts about my role in working with our customers. And we're very pleased to have a chance to highlight several great stories today. But before we introduce the first panelist, I'd like to let the audience know that the tools that you see on this slide, benchmark reports, educational materials, professional certification training, these are all going to be discussed by the panelists, and they'll share how these tools have helped enable their own stories. And as a customer, all of these tools that you see, combined with the ideas that you'll hear today, no matter if you're a brand new customer or a longtime customer, can be used immediately by your organization and by your privacy team. So hopefully by learning the ways that our panelists have utilized these tools, it'll provide the knowledge needed to help achieve the privacy goals for your organization. So with that, let's introduce our first panelist. And starting today's discussion will be Tina Tolliver. Tina is the Corporate Compliance Director and Privacy Officer at Cookeville Regional Medical. Tina is going to share her experience in starting with a new organization, how she's quickly gained senior executive support to invest in privacy, and how she's helped their organization, as well as herself professionally, achieve the highest level of certification this past year. Tina?
Good afternoon, everyone. I began working here at Cookeville Regional about 2.5 years ago, and I am actually their first dedicated privacy official. It was typical as far as people wearing hats by the medical record director, medical record manager, as far as being the privacy officer. And so coming in, I felt compelled immediately as far as trying to conduct or attempting to conduct a gap analysis. In doing so, I actually discovered the Fair Warning product that was, I want to say, basically sitting on the shelf collecting dust, which was kind of to my amazement. They had only used it in a minimalistic way as far as conducting a little bit of queries and clarifying some small identity issues. And so one of my first, I guess, executions as the privacy officer was that I was going to dust off the Fair Warning product for sure and get someone in here so I could, as a privacy analyst, to be able to develop that monitoring system. And that was, again, one of the first things that I did as far as get the Fair Warning product up and going and updating it with for integration with and interfaces with all of the other medical and information that was needed interface with the Fair Warning product. In doing that, we obtained the professional level, which everybody knows that there are a variety of levels Fair Warning offers to achieve. And when I guess got the privacy or the professional level, I saw where there was other possibilities of greater levels to achieve, and I wanted to, go to that next level. Where and how could I do that? And so I started accepting, the invitations to training, to the user group activity that Fair Warning was offering, and then, seeing that there was another, again, layer of certification that they were offering. In the interim, as far as going from that point further, I also created a privacy committee. It's been going on for 2 years now. Actually, this month we had our annual luncheon, which was a really great contribution to the privacy campaign that I wanted to initiate out there. And our print shop and I created badges, and we named everyone on that committee a privacy deputy. They came up with a mission, and I want to say a small element of that mission that they created was to protect the honor and the dignity of our patients' personal health information with respect and accountability, which, again, that helped build up some staff ownership into that privacy committee and what we were trying to accomplish. And moving on from there, the committee did more work as far as creating some privacy posters, and we actually introduced another part of our campaign, which is an avatar, and we called her Privacy Polly. After the first year of the campaign and of the committee's work, we conducted surveys requesting, kind of the interpretation of how people felt about our privacy work and efforts in that. And we communicated that using our avatar Privacy Polly. The results came back, and they were absolutely fabulous. The comments were positive. We had achieved a 90% compliance as far as the people attending the privacy training throughout the year, and they actually were asking for more privacy training. So we had obtained, buy-in and enhanced the knowledge and the application of the privacy rules, again, through some of those steps in that work. We also, again, as far as using Privacy Polly throughout the year to communicate outcomes from our Fair Warning enforced policies and the outcomes of those alerts and those incident trends that we identify. And those are kind of really key and pivotal for people to be able to understand kind of that we are, again, monitoring the patient privacy on a daily basis. They see exactly what those outcomes are. Again, it's a really, I would say, robust instrument that we feel very, I would say, privileged to use and to be able to show our work. And it means a lot as far as being able to go out to those departments that we attend on a monthly basis to be able to, again, demonstrate where those trends and those incidents are coming in through. And so we can, again, just show the stakeholders in our community what we're, again, doing in our attempts to protect the patient privacy. Around the end, I guess, of 2013, our organization became a Master Certified Care Organization. Myself and our privacy analysts we have here and our security manager all successfully obtained the Fair Warning Certified Master Professional status. And we shared that, I guess it's a prestigious award for us to be able to show that to the press, to the stakeholders in our community, and it just, again, shows our passion in protecting patient privacy. It just demonstrates our continued drive for better population health, and it solidifies our reputation as our mission stated as far as protecting patient privacy for the honor and dignity of our patients. In this next year, we're going to be able to, because of us, again, executing the fair warning and dusting it off the shelf, we're going to be able to do some benchmarking within our own facility. We will have 2013, 2014, and 2015 outcome data to be able to, again, hopefully demonstrate, which I'm sure that we will, that where we have improved our processes in that. So I'm really, again, proud of what we've been able to do. We've committed, as CRMC as an organization, we have committed to layering and our privacy infrastructure out. We've defined the roles and responsibilities through, again, assigning a privacy officer and having someone in there working the fair warning product. We've matured our budget as far as being able to expand it with some of the, again, the hardware and the software that we are obtaining from fair warning. And then we're also simplifying and improving our training process through our avatar and through the monthly meetings. And basically, it is embedding our privacy principles in all of those workflows as fair warning provides it in their product design. So it really, again, helps us to be able to, again, demonstrate what we do and gives us, again, that edge, I think, as a outstanding privacy organization within the Upper Cumberland area.
Perfect. That's great. That's great, Tina. Thank you so much for sharing. I think we're going to have a lot of interest from our customers about the certification programs after this call.
Great, and thank you, Tina, again. And as we transition to the next expert, I do want to remind everyone this is a unique opportunity where we have so many experts talking about different topics that are important to all of us. Please take the opportunity to pose your questions. I mean, these are people that are in the trenches and implementing these things. Take the opportunity to ask the questions, and we will hopefully have time at the end to be able to respond to those. So, Brian?
Yep. Thanks, Shane. So our next panelist that I'd like to introduce is Charles Fletcher, the Chief Compliance Officer at Maury Regional Medical Center. And Charlie is going to share how they've been using the training tools to help increase the use of their fair warning solution, as well as the expertise for his team that has enabled them to expand his monitoring program at his organization. Charlie?
Thanks, Brian. You know, like most of the others on the call and the other panelists, we recognized as a facility the importance of patient trust, that their information will be kept private, and the adverse consequences that could result if patients didn't trust us and didn't share their deepest and darkest secrets sometimes. So we stepped up our compliance program starting a couple of years ago, and really what was driving that was the increase in the penalty amounts. You know, we've seen those go up astronomically over the years, and we decided as an entity that we're not going to tolerate being selected for an audit or receiving one of these multi-million-dollar penalties. So we expanded our monitoring program from what started out as just monitoring our main clinical system, which is Meditech, and to that we added a couple of our satellite hospitals, which were small rural hospitals. We also added our imaging PAC system to the privacy monitoring that falls out under fair warning. And then last year, kind of the final piece of the puzzle came into place when we added our multi-specialty physician practice, which they use a system called NextGen, but all of those systems are now brought together and monitored using the fair warning software. And I think that's allowed us to really expand and gain that confidence that we're covering all of our patient population and all of our employees. It's kind of simultaneous with the rollout of the additional facilities and the expansion of our privacy program. We also had a dedicated resource that is dedicated 100% to patient privacy. She's our analyst. She runs the software, and she has also attended some of the training seminars and achieved the Fair Warning certification and was awarded with the SHIELD achievement level. And you know, we put that out in a press release to the community to let them know that we took patient privacy seriously. And we also announced it to all of our employees as a reminder to, you know, be mindful of patient privacy. That also allowed us to move from a reactive type situation to more of a proactive situation. So in other words, rather than waiting for Fair Warning to tell us that there's a potential breach somewhere, we've actually gotten to the point where we'll program in things that show up in the newspaper. Many of you may be in small rural areas like we are, and if there's a shooting or if an infant dies suddenly of, you know, in their crib, these things hit the newspaper and employees want to know. They get curious, and so we now program a lot of that stuff in proactively and selectively monitor those types of events that appear in the local newspaper. In addition to that, new employee orientation and annual orientation, we tell our employees about the fact that HIPAA requires that we monitor medical record access and that we have this software in place, and you know, we give them as a freebie, we give them the last name match, and you know, just explain to them that if you know, if Charlie Fletcher is accessing a medical record of another person with the last name of Fletcher, what might that indicate? It could indicate you know, potentially snooping on a family member, an adult child, a spouse, an ex-spouse, you know, lots of things. And you know, so we kind of use the slogan of forewarned is forearmed, and basically let everybody know that this is a Medicare requirement, a CMS privacy requirement, and that we do use that software. I guess one of the biggest benefits that's come from the training and the certification that Fair Warning provides and the monitoring reports would be the way we were able to change our workflow and really zero in on those true violations. So we may get, and I'll just for ease of reference, say we get 10 alerts a day. We're usually able to eliminate, you know, 5 to 7 of those as false alarms, because our analyst is dedicated, experienced, and she's been through enough of the training at Fair Warning that she knows how to design her workflow, and she knows how to analyze the reports, look for patterns in employees' access, and recognize those accesses that don't fit their normal daily pattern. And when we come across one of those are the employees that we bring in, and we interview them with their managers to find out, you know, what the access was all about. And I suspect one of the biggest benefits of that has been eliminating the anxiety associated with a false positive, for lack of a better word. But you know, when you have a hit in the system and you call an employee and tell them that they have to come to Human Resources and meet with HR and compliance, that generally doesn't give them a very warm, fuzzy feeling. And so being able to eliminate any false alarms, I think, has been a real benefit to the organization, and we don't have people, you know, worrying all week long of, you know, why am I being summoned to HR by compliance, you know, because of the training and the certification and the experience of our analyst. I think that's been very beneficial. And then as far as the reporting statistics that we get, you know, we share those statistics every month with our Audit and Compliance Committee of our Board of Trustees. We share the reports, and then we also graph out some of the specific statistics, and we've been able to see a very positive downward trend in the number of hits and the number of true violations that we're incurring as an organization. So I really feel like, you know, the word's gotten out. All of our employees know we take privacy very seriously. Fair Warning has allowed us to really gain that expertise and zero in on those issues that are true issues as opposed to false alarms. Small community like ours, there's an awful lot of people that seem to have the same last name or, somehow know one another. So, being able to eliminate those false alarms, I think, has been a real positive thing for us. And also, our employees appreciate, not having to worry about false alarms.
That's great, Charlie. Thank you very much for sharing. I think just in our previous conversations, the part about reducing the employees' anxiety, that really hit home for me, that in order to have confidence from your employees, it's really important that your team has the right qualifications and experience, which enables the trust to expand your monitoring program. So thank you again for sharing that.
Sure.
So, want to go to the next? While Tina and Charlie represent organizations who have been longtime customers, our next panelist is a newer customer, but I don't want that to fool you because her organization has achieved quite a lot since their start. I'd like to introduce Pat Hendrickson, Chief Privacy Officer at Banner Health, and Pat is going to share how they've used benchmarks, both internal benchmarks and benchmarking themselves against their peers to help direct the growth of their monitoring program. Pat?
Thanks, Brian. Good afternoon, everyone. I have been at Banner Health for 28 years, and I have been the privacy officer since 2001 when they hired a privacy and security officer at Banner Health. We are both still in our positions, so we have developed the Banner privacy and security programs since that date. We are, as you know, in 7 states and have 24 hospitals plus lots of other services. So ensuring the privacy, security, and confidentiality of personal health information is a fundamental principle for Banner's workforce. The workforce continue to face the challenge of maintaining the privacy and security of patient information, an effort that grows in complexity as information becomes more and more distributed in electronic systems. The challenge of this responsibility has also increased due to the constantly changing legislative and regulatory environment. Banner has had a graphic demonstrating the strategic steps developed over a 20-year period, and this graphic is moving us towards our goal of being recognized as an industry leader by 2020. So our 2020 vision is we will be a national leader recognized for clinical excellence and innovation, preferred for a highly coordinated patient experience, and distinguished by the quality of our people. Since 2002, Banner Health has had a system-wide commitment to privacy, overseen by the HIPAA Steering Committee, whose members are senior leaders at Banner Health. Quarterly privacy and security information is shared, including benchmarks across Banner locations. Semi-monthly privacy and security calls bring together privacy professionals from all Banner locations to discuss operational progress and best practices. Privacy and security policies and procedures are standardized across all of Banner Health. There is also enhanced collaboration among privacy, security, and information systems. Banner created 4 characters to help make communications about privacy and security more fun and memorable for employees. Since implementing patient privacy monitoring, Banner has been able to increase awareness among employees that they are being audited, as well as increasing support from senior leaders. As you see on the slide, that is me in the FI suit. We have 4 characters. One is PHI. It has a purple shield with PHI on his chest. The second is a LIPS character designed to remind staff to respect privacy and conversation. A computer character who promotes secure electronic information, and a binder character who promotes safe written health information. When our employees see these, they know it's a message from privacy and security, and we have had a lot of fun with them throughout the years. Banner implemented Fair Warning the third quarter of last year. We monitor 5 applications, and Banner's applications are system-wide, so we have 1 application for inpatients, 1 for ambulatory, 1 for obstetrics, and we have an employee loss and database, and some of our ambulatory has another application. So even though it sounds like there's not very many applications across Banner, it covers all of Banner's system-wide. Since 2003, Banner has had a system-wide reactive reporting system for privacy events, violation breaches. These events are entered into a HIPAA database, and graphs are produced for corporate and facility leaders. In 2014, we added information regarding the proactive monitoring from Fair Warning. The monitoring effectiveness reports that we get from Fair Warning assist us to increase the adoption of patient privacy monitoring and maximize our investment with Fair Warning. We review the key areas of our program and measure how we compare with similar Fair Warning customers. It shows us total number of reports run on demand over time, total number of alerts created with the total number of alerts closed, and total number of investigations opened with the total number of investigations closed. In 2014, Banner Health was the 5th hospital in the nation to receive the Fair Warning Ready Award, the Master Achievement Level. And you will hear more about this later on in the webinar today. Banner respects the privacy of our patients and wants them to trust our ability to keep their information secure during and after treatment at our facilities. We strive to ensure the highest level of care, and protecting patient privacy is one aspect of that care. For a patient to receive the best possible care, a growing number of physicians, clinicians, administrators, and affiliates must have access to patient information. While the vast majority of those involved in the patient's care use sound judgment, a care worker may mistakenly or purposefully access patient information that is not necessary to care for the patients. Fair Warning's patient privacy monitoring solution provides Banner with the ability to detect these anomalies, training staff, and prevent further occurrences. Patient privacy monitoring and best practices are essential for earning our patients' trust, ensuring the highest level of care. Banner Health also won the healthcare industry's top honor for privacy for Best Large Healthcare Provider, Western United States, 2014 Privacy Excellence Award from Fair Warning. We were recognized for commitment to building goodwill and trust with patients every day by investing in and living a culture of patient privacy. It showcases Banner Health leaders from around the world who are committed to deliver better care and creating a culture of privacy and compliance through courage, innovation, and dedication. 6 months ago, the Vice President of Business Health retired at Banner Health. Under new Vice President leadership, the business health infrastructure is being evaluated. I report to this Vice President. With a new Vice President, data on proactive and reactive monitoring, utilizing Fair Warning, and the integration of the University of Arizona Health Network has provided an opportunity to reorganize the Privacy Office in 2015. Central system deployment with line regional privacy individuals and HIPAA facility contacts at each location is our reorganization structure. A 2015 goal will be to utilize Fair Warning Investigation Module for all monitoring activities at Banner Health, proactive, reactive, and all federal and state reporting. Personal legacy, I guess a personal legacy would be that Banner Health is a company that patients and members can trust with their personal information. Ensuring the privacy, security, and confidentiality of personal health information is a fundamental principle for Banner's workforce. Banner is proud of our ability to utilize Fair Warning as a tool to build trust between patients, employees, and other businesses or government entities. The implementation of Fair Warning across our enterprise demonstrates our organization's commitment to protecting patient information. Thank you for listening.
That was great, Pat. Thank you again for sharing. And I think you just provided a great lead-in to our next panelist. And during Pat's segment, she mentioned Banner Health plans for the coming year and expanding their monitoring and monitoring for specifically a large enterprise health system. And again, it's great to lead into our next panelist, who is Doug Clarkston, Privacy Officer at Beaumont Health System. And Doug's organization actually played a key role in the configuration of Delegated Workflow Review, which was developed into the Fair Warning solution for all of our customers and enables them to share the monitoring activity to a large population of users while keeping a smaller centralized team for that final review of inappropriate access. In addition to this, Doug is going to be sharing how Beaumont Health System uses their Fair Warning solution to help maintain a strong culture of privacy, one that they've had in place for a very long time. Doug?
Thank you, and good afternoon, everyone. At Beaumont, we've had an EMR system in place since the mid-1980s. And by the early 90s, we had vast amounts of patient information in our EMR. We've had a privacy committee in place since the early 90s. We've had ongoing monitoring that's occurred since that time, and to the fact that all the users to our electronic medical record, we have monitored every user at least once a year. So we had a pretty robust monitoring system in place, and everything was working fine. In the mid-90s, we had very high-profile patients. 3 patients came into Beaumont, to our flagship hospital. And what we found out in our monitoring is that we had many people that inappropriately accessed the chart. At that time, our CEO said, that's it, we're going to have zero tolerance in place. You communicate the policy, and there will be no second chance. One violation of privacy will be termination. So we've had a very robust process. In the mid-2000s, we bought the Epic system. So we transitioned out of our original EMR. We had to. And Epic is a wonderful system, but it was very difficult to do the monitoring that we wanted to do. We had very customized monitoring reports in our previous, but of course that was very time-consuming for the IT staff to maintain that. So we quickly realized from 2006 through 2009 that what we were doing was not meeting our needs. So that's when we purchased Fair Warning in 2009, and we implemented in 2010. And it really provided a great tool for not only monitoring Epic, but multiple systems. But what was happening is that we had vast amounts of alerts. We still had to run the reports. We had to distribute them. We have distributed reports to department managers since the early 90s. So every manager, at least once a year, received a report on all of their staff that had access to electronic medical records. And so a few years ago, we engaged Fair Warning and said, you know, here's our process. We liked our process that we did for many years, 15 years. Can you help us duplicate what's that? And they were very helpful in setting up a delegated privacy monitoring process. So since May, we have been shooting out alerts to managers. The reason why I wanted to do that is I wanted to take privacy and privacy monitoring right into the departments the way that we'd always done. And that sends a message to the managers and to the employees that privacy monitoring responsibility really is even involved in the department. And the key thing there is I wanted our employees to be able to explain to a patient, if a patient ever expressed a concern that they were concerned about their privacy, every employee here would know we have zero tolerance. We don't tolerate privacy violations. And secondly, I know that they monitor all the time. So since May, we've been sending out approximately, on average, 700 alerts a month to 400 managers. Fair Warning was very helpful to work with us, and we had to work with Epic to get enough information in those alerts that managers could quickly resolve the alerts. So for instance, when you receive an alert, you would know if the patient was in your area. You would know enough information, and my goal was that no manager would have to spend more than 2 or 3 minutes relieving an alert. Have the information, or if it didn't make sense to them, they could request for additional information. That would then come back to the compliance department. We would run additional reports. So we've gotten great feedback from our managers. So we've sent out over 5,000 alerts since May, and I ask for input all the time from our managers. They like this process a lot better than the process that we even did years ago. We tie in a lot of what we do with the Fair Warning monitoring, and I would have guessed that all of our managers know at Beaumont. We have over 20,000 employed users that have access to our clinical systems, and actually over another 10,000 non-employed. So over 30,000 users are being monitored, not monthly, but continuously. And we tie this in a lot with, Epic has functionality called Break the Glass. So what we do, one of our leaders at our health system asked that if we could do some monitoring that would be non-punitive, like we wouldn't have to take away their job. And one of the major things that we do right now is called Bump the Glass. So if somebody gets to the Break the Glass window, there's a communication that goes out on a monthly basis to managers and say, hey, you have a staff that bumped the glass. They didn't violate the patient's privacy, but they were clearly not doing their job because they didn't go into the chart. So it's a good way to communicate privacy, to have a discussion between a manager and an employee in a way that we don't have to terminate. So we tie Fair Warning in with Break the Glass and all the messaging that we do. I know that we're running short on times here, so I'll wrap it up. If anybody ever has any questions, you can certainly contact me through LinkedIn. My email address is dclarkston@beaumont.edu. So I'll turn back my time.
Thank you, Doug. That was a great story. I know that we have a lot of large enterprise health systems on the call that appreciated hearing your perspective. So for those of you on the call that maybe don't have the same resources or people that Pat plans on having in 2015 and Doug's team has to implement a proactive monitoring program, many of our customers have contracted with us for additional services to perform the daily monitoring and review. Our next panelist is Tara McGibbon, Privacy Officer at Susquehanna Health System, and Tara is going to share how this service has helped not only move her organization to quickly reach a proactive state of monitoring, but has freed up her time to focus more on bringing privacy awareness and developing her organization's ongoing educational initiatives. Tara?
Thanks, Brian. Good afternoon, everyone. As Brian said, we do contract with Managed Privacy Services. When we first, we've been customers for about 4 months now live, and when we first started looking at Fair Warning, we had a couple of things that were driving us to this application. And you know, one of the things was that we knew that we were having privacy issues behind the scenes, but that we didn't really have a way to monitor that. I am a one-person department. I don't have any support staff to kind of assist with that. So what our fear was that these little violations, you know, snooping on your own record or snooping on your child's record would lead to bigger violations. And we wanted to get that under control. We wanted to make sure that we could move from a complaint-driven investigation to some type of proactive monitoring. And the other thing that we were concerned about was, patient trust is huge in the healthcare industry, and we didn't want to face any kind of loss of patients because they didn't trust us. So we wanted to make sure that we did everything we could to gain our patients' trust. And we had already had, for the most part, had our patients' trust, but we wanted to make sure we could build on that as all of our patients, and I'm sure many of you are facing this as well, are becoming more and more aware of HIPAA and what their rights are. So we want to make sure that we're telling them and we're being proactive about it. This is what we're doing to make sure that your privacy is protected. So some of our goals were to obviously, make sure the education and the awareness was out there to everyone. We had policies in place, but we didn't feel like everyone knew what the policies were and how they were supposed to be followed. We wanted to expand the trust with our patients, and we wanted to reduce the number of incidents that we knew were going on behind the scenes. So when we contracted with the managed service team, they really help with the day-to-day assistance. I have one specific person that I work with very closely. He's been absolutely wonderful. So what he does is he actually will manage the alerts, and then any that result in an investigation needing to be done, he will send on to me. So that piece of it is handled by Ryan on the managed service team. And they also really assisted us with the education and making sure that we had a foundation to move out to our employees, our med staff, even our corporate team. They also provided us with a press release that we could inform our community with as well. So when we first started this, I was aware that we were going to see our numbers go up. And we did. We saw them go up, but we are already, only 4 months in, we are already starting to see our trend go downward as to the number of investigations per month. So what I'm seeing and what I'm hearing from our organization is that the word is out there. People are understanding, what they're not allowed to do and why they're not allowed to do it. I had corporate member come up to me and say that my name was being passed around the med staff meeting, and typically that's kind of scary for me. And they said, no, it was all good, and the med staff is very supportive of fair warning, and they were talking about, what it means for their practices or their departments within the hospital. So very good. When I can get a positive out of the med staff team, I feel very great. I have huge corporate support in our leadership team. I haven't had one negative thing come back from any investigation that I've put through. So that to me, as long as I have my upper level supportive, I really believe that our frontline service partners will be on board. The ones that aren't already understanding, will get there as soon as they see, the impact of how this can protect them as well. A big thing for us is that many of our service partners are also our patients. So we want them to understand that this is, for them as well. So awareness within our organization, our community, we really felt that it was the only way that we could do this effectively. So building that education is great. Someone said I went silent on the question, so I'm hoping everybody can hear me.
Yeah, we can still hear you, Tara.
Okay. I'm all done. That's
great. Well, thank you very much, and that was another great story. And again, that kind of leads us into our next topic, and it's about the ethical use of patient privacy monitoring. And again, this is a very hot topic for our customers as well as our founder, and I want to pass this back over to Kurt Long to share a few thoughts before passing it over to our next panelist.
Yeah, so this is Kurt again. And for myself as the founder of Fair Warning, when you begin to see patient privacy monitoring really become part of the fabric of healthcare, and you realize how many lives that we're changing, and dramatically and mostly for the better in terms of patient care, and often the technology is used to prove people innocent. But we also know that we find people that are behaving badly. They're doing things that they shouldn't, and it kind of raises the question: how many lives will our legacy be in terms of how do we impact this industry in the future? And you start thinking about, well, how could this be misused? Whenever we have monitoring technology, could it be misused? And we begin to put together a committee here privately of customers and internally to discuss these issues, because for 2015, I want Fair Warning to be at the forefront, at least within healthcare, on the topic of ethics and integrity. And Deborah Reif is one of those persons who stepped up and wanted to be part of that conversation. And I think, Deb, you're ready to go now, and I know that at least on our internal sessions you had really great insights. I hope you can be open and connect with the audience here today on what I think is an incredibly important topic going forward.
Absolutely, Kurt. Thank you very much. This is an area of passion for me as well. Ethics and integrity in all areas of business are important, and I am convinced that no compliance program is complete without the consideration of the ethical dilemmas that do arise from time to time. Patient privacy monitoring is no exception to this rule. One of the reasons I would say that is because even the most well-intended request for data can lead to an ethical dilemma if the provision of the data leads to an action or a decision that is outside the scope of the intended use of that data. So, as we know, there are no etched-in-stone processes for resolving ethical dilemmas, and that's why it's important to take these into consideration prior to embarking on or the realization that you have a dilemma. And one of the areas that will help immensely is to have clearly defined processes and policies that state what this fair warning data is to be used for, and that use is always consistent with the intended purposes. The next idea is that organizations have the regulatory responsibility for scaling privacy programs for risk analysis as well as their size and capacity, but we also, from an ethical perspective, have an obligation to utilize the tools that we have at our fingertips. Once an organization commits to the purchase of a system such as Fair Warning, we all have an obligation then to ensure that it's implemented and maintained, and that the outcomes of each and every investigation are consistently and systematically resolved. So, of course, the tools that we have available to us, while they increase the ethical obligations that we have, a lot of times an organization may find that they don't have adequate staffing or that their processes are too disjointed to be able to continue in that manner. And you heard a couple of presenters earlier who stated that they had to modify their processes, but have found this to be a very usable tool going forward. The advanced threat monitoring, I think, is something that we all have an ethical obligation to really get our hands around and to work toward reducing the very large percentage of internal identity theft in healthcare organizations. And, with using those threat monitoring tools that we have, we will be able to fulfill our ethical obligations. And finally, of course, the last but not least is the consistent handling in the inappropriate uses and disclosures of PHI. Normally, an investigation will be very cut and dry when it's an employee who has been a bad performer. And the elephant in the room is, well, what do you do when leadership doesn't want to take action because a prominent individual, perhaps a physician or individual who's in the high levels of leadership, have inappropriately accessed or used the PHI? And this is where it is very, very important to know that you have your senior leaders supporting you and that you have very well-defined processes for corrective action. It's very important to make sure that the organization is 100% behind the sanctions that are potential for violations of privacy. One thought that I would say is that prior to beginning any investigation, you would want to have a conversation with the potential individual's management to ensure that they are clear on what the corrective actions are potentially going to be. And then once that conversation is had, you may have some spoken and some unspoken expectations of excessive corrective action or perhaps lenient corrective action in order to satisfy the needs of that particular department. And you would not want to coalesce with those expectations for the mere fact that consistency in a compliance program is probably the most important piece. Otherwise, you will have people pushing and asking you to bend, and it is it's incongruent with what the regulations expect. So always have that in your forefront. And as Kurt said, there are many, many things that we could talk about when it comes to ethical use of the fair warning data. So thank you.
Thank you very much, Deborah, because I think you have the courage to take a leadership position on what I think the audience that's listening today, I think we all know that the topics that you touched on are difficult and real for many people. So I look forward to continuing the dialogue with you in 2015. We know we're running short on time. We've had a rich speaker set today. We're going to make one more announcement, and then we'll begin transitioning over to questions and answers. If you're unable to stay on for the duration of the webinar, we will include the full recording in the distribution later so that you can pick them up. We had Dina Bogan, who was last year's Outstanding Privacy Excellence Award winner overall from St. Dominic's Hospital, was to speak today, but unfortunately, Dina has someone close in her family that's taken ill, and Dina's spending time with her. It's hard for me. I almost consider Dina part of our family here. What I do want to announce, though, is that we're going to kick off the 2015 Privacy Excellence Awards. It's really to give recognition to the privacy heroes in this industry that are otherwise, really don't have much positive. There's just the wall of shame. There's all negative news. But I think everyone on this webinar knows how courageous today's speakers and many others are. So it means a lot to us to give this out. Brian, could you share, I'm sure by now people have been able to read the bullet point slide. So just for time's sake, could you walk us through the application process for 2015 for those who might want to get involved?
Yeah, absolutely. And so your Customer Success Manager will be sending out information on February 1st. It'll have information about how to apply for the program, for the award program. You can see that we'll be finishing that application process on March 1st, and really excited to be able to announce and hopefully present the awards to the winners at the HTCA event in Orlando, April 20th. So we're excited to start rolling out that program for all of our customers.
Yes. So for now, we can do a few moments of questions and answers. I know we have a lot, so let's get started. Do we have a first question?
Okay. This first question, I'm going to unmute Tina here, is what would be a good strategy for certification? And this is to Tina.
As far as the certification with fair warning, I just started, I want to say, talking with Brian a lot initially as far as just knowing what it took or what the expectations were for the professional level, and then as the criteria was built for the master level and being able to attend I think that you guys are doing training twice a year now, and being able to go in and set for that week-long training for the master certification, and you just learn, I'm going to say, so much as far as being able to be there and learn more about the product and what you can and what its capabilities are is enormous. And so I think it's just, again, connecting with one of the customer care team members and knowing exactly kind of when you can get in and be in the community and speak with them. And I think it was just, that the connection that we started with Brian, and then it just led to Christine, who's our customer care representative now, and just staying, I want to say, in communication at all times, because it really it helped out.
Yeah, and the only thing I would add to that, Tina, that was great, is the Fair Warning Certification Training is held in Clearwater, Florida. It's 3 times a year, and we are taking registrations now for the February course. So, hey, thank you very much.
All right, the next question I have here is a managed service offering as reliable as a dedicated FTE would be? Do managed services have the ability to detect workflow anomalies? Do we need an analyst with specific EMR knowledge?
In general, the answer to all of those questions is yes, that our experts are familiar with different electronic health record systems, whether it be Cerner, Epic, and otherwise, and then our managed services team works with the customer to understand their clinical workflows, and we also maintain those familiar with clinical workflows on our staff.
All right, next question I have is for Doug. This one is, how did Doug get buy-in from the frontline managers? How did HR respond with a policy that enforced termination after a single violation?
Well, I think to put it into place right now would be very difficult. But since we've had zero tolerance in place for almost 20 years and managers were used to getting access reports, we built it into our corporate privacy policy that managers would accept and receive and react to access monitoring. And then also in the last year or so, we have created an access monitoring sub-policy for the privacy policy. It's required under policy. It's supported by our top leadership that we will have this done. And also we have a concept here called department compliance plans. So every twice a year, managers have to attest that they've completed that access monitoring. So in that we've had it in place for so many years, I could certainly see that it would be a very tough sell. Just like at Beaumont, it was a very tough sell to put this break the glass in place. But I would be glad to speak to anybody to offer suggestions on how you could go about doing that also.
Great, thank you. Thank you very much. And this is Shane, and just again from a time perspective, I know we've gone over, but we still have approximately 250 folks still attending live, so we're going to keep going through some of these questions, and I appreciate everybody's participation. Mike?
Okay, this question I have is for both Tina and Pat. If Tina can answer this first, and then we'll hand it over to Pat. It says, great ideas for avatars. I've drafted something but different from a poly for recommendation to our privacy officer. How does Tina and Pat introduce the avatar or privacy information emblem to the employees?
I send them out in emails. I have it's almost like a PowerPoint slide, and it has my avatars sitting there off to the left-hand side, and across the top it just says, Privacy Poly says, and all those messages that I want to send out to the staff are basically I enter that text into that information, and then I have our privacy hotline number and our privacy email address located at the bottom. So, and again, these are messages that where an incident may come up. We had one, again, as far as communicating with friends and family. That's a hot topic as far as in our rural community here, and doctors and nurses were, kind of unsure, and we were getting complaints about, from patients saying, well, they spoke while I was in the room, or when I didn't have somebody else in the room, and so, we started getting a lot of those, and so that was something that Privacy Poly, could get out there and communicate, and it was so much more receptive. I mean, the staff, are, instead of having, again, well, this is coming from the privacy officer, and, again, and feeling that intimidation to a certain degree, they would see it coming from this avatar, and the avatar, they were looking to it. I know that there was this one, and I don't want to take too much time, but there was a meeting where our leadership was off in a conference, and they were talking, they had an attorney general standing up in front of the class that the management was in, and they were talking about you need to have your privacy program together and all this, and started talking about it, and they all looked down at their phone or their iPad, and I had just sent out a privacy poly, and they were going, Tina's got it taken care of because here she's sending out a message. And so, you know, it even, again, made leadership feel comfortable as far as being able to have those messages go out and being, again, receptive to them. So.
Great. Thank you, Tina. And Pat, were you able to comment on that?
Certainly. Banner introduced those 4 characters in 2003, and we have used them consistently in the 11 years as it relates to they're exposed to them in the education, the orientation, and the annual education that we do online. We use those characters in that education process and communicating that. We also use the characters on the Banner Health intranet, which we have a HIPAA site, and they're on that site and help to explain the HIPAA rules. We use them in posters, we use them in email, so Banner Workforce has gotten very used to, if they see one of the characters, they know that it's a message from privacy. And it's made it a lot of fun. You have to make privacy fun, and that's how we've done it.
Hey, Brian again, and I want to bring Tara back into the questions. We had a previous question about managed privacy services, and it was specifically asking about workflows and is it as effective as a full-time employee? And Tara, do you have anything to add or a comment to that question? Tara, are you still on the call? I think we might have lost Tara.
Yep.
Okay.
All right. Question 10 is, how does that policy, and I think this is for Doug specifically, how does that policy, one violation equates to termination, comply with the meaningful sanctions requirement?
I guess as far as responding to the meaningful sanction requirement, I'm not certain what the question reacts, you know,
Yep.
what's.
Doug, this is Kurt. I think maybe, you know, if we kind of reposition that, the intent of it, it could be one of 2 things. One thing is a sanctioning policy or general policy guidelines as required under HIPAA, or this particular question might be directed more toward meaningful use. Many of our customers are concerned about meeting their meaningful use attestation. So whether it's from a HIPAA perspective or an MU perspective or both, maybe answer it within that context?
All I can relate our policy to is that we are very strict on if the manager, and keep in mind, me or the compliance office, we do not determine that a privacy violation occurred. And we stay away from the term a HIPAA privacy violation because the only one that can determine that is the OCR. But if we have a privacy violation, we have just determined that there is no excuse. We train people when they hire in, they sign a confidentiality agreement. So as far as relating to anything, we've had a couple court cases that have gone through with our termination process, and we've been supported in every case. We've had a couple cases where the Office for Civil Rights has contacted us on privacy violations. Once they hear that we terminated, the discussion literally ends and the case is closed. So we think we're fair with our staff. We identify if you violate privacy, you will be terminated. And I'm sorry if that doesn't address the question specifically.
Thank you very much. I thought that's very comprehensive as we're going to get. And then I think we've got Tara back, so I'd love to get that question in.
Yeah, Tara, did you join us back on the call?
I did. I'm sorry.
No, that's okay. We did have a previous question about managed privacy services, and we wanted to bring you in and get your perspective. And the question was around the workflows and is this program as effective as an FTE?
Well, I think when you measure it against an FTE, it depends on how large your organization is. So we are a smaller organization than what I'm hearing from some people. We have about 4,000 employees. So I wouldn't say that Ryan would be equivalent to a full FTE for us, but I do think he would be a part-time FTE for us in terms of the work that he does, managing the alerts that come through and working on the investigations. For me, it's absolutely necessary. Being a one-person department, there would be no way that I could manage that side of the monitoring as well as all of my other daily responsibilities. So I think that it's absolutely essential and well worth, what we need it for.
Perfect. Thank you very much.
Okay, next question I have is when access reports become required, is fair warning set up to provide that data? And I think I'm going to turn it over to Kurt for this one.
So it's for a portion of the accounting of disclosure access reports rule with regard to internal access. That's certainly something that we feel like we can fulfill on and something that we're tracking very closely. However, the rule as currently written, and it's a little bit easy to lose track right now with the transition of leadership at the Office of the National Coordinator and a reassignment of the Tiger Team Committee members, I'd have to get an exact up-to-the-moment status as to where that rule sits. The last time I saw that rule, I did not feel it was practical to implement, and we testified with regard to a path forward to the Tiger Team and ONC with how we viewed it being practical for our customers. So my message is we're tracking this very, very closely and feel that we have the technology to fulfill on a major portion of the rule. And there was one more question. We'll do the last question, which is, and this goes to the concept of I think we need clear certifications and more prescriptive measures from OCR, ONC, wherever it falls from. But it's a concept of how much auditing is too much. Does the HIPAA security rule require this level of auditing? How can we better gain senior support? And I think that question could be for any of today's panelists. So does anyone volunteer on that one? Last word of the day? Pat, Doug, Charlie, Sarah?
I will. This is Charlie.
Yep.
I think the question was buy-in from senior leadership. Is that correct?
That, and really, I think the essence of the question is, how do you know when you're doing enough auditing? Is auditing really required under HIPAA? How do you know when you're doing enough? And how do you get senior leadership to conduct that audit, I think is really the essence of that question. It's kind of 2 or 3 parts.
Yeah, and maybe I'm lucky, but our senior leadership has always recognized the importance of patient privacy and patient trust, and it really gets back to the caregiving model that, if patients don't trust us, they may not tell us that they're using illicit drugs. We may prescribe something that has an adverse reaction and so on and so forth. So the buy-in's really been there for privacy. If you're talking about buy-in for expenditures, for things like fair warning software or a privacy analyst, I think the easiest way to do that is, would we rather spend, X number of dollars internally on an analyst and some software, or would we rather pay, take the chance of paying a $1 million plus fine or penalty due to a breach or a patient complaint of some nature? So I think you have to look at it holistically and weigh the pros and cons of the expenditures, the buy-in versus what could happen if we're not properly auditing. And I do think auditing is clearly required under the HIPAA privacy and security rules. They talk about monitoring, safeguards, all these sorts of things, but you could call it monitoring, you could call it auditing, you could almost call it whatever you want, but the bottom line is we've got to make sure that when people access patient records, whether they're paper or electronic, that those accesses are appropriate, and that information is used only for the task at hand or for the treatment or billing or whatever of that patient, and not shared outside of need-to-know purposes.
This is Doug. My reading of the regulations, the security regulation, is that if you're not auditing for privacy access monitoring, I don't think you would be in compliance. So I think an investigator would look pretty severely if you were not doing routine access monitoring.
Yeah. And this is Deborah, and I would have to agree with you on that, Doug and Charlie. And I will tell you that, you know, when it comes to scalability, if you have a large organization with multiple hospitals, your risk is essentially going to multiply just as quickly, and you do have that obligation to audit and monitor in accordance with your organization's capacity. And you can't have systems with all the bells and whistles and not have a comparable auditing program.
Thank you very much. And I think we're at the end of our time today, and I just want to give the final thank you to all of our customer panelists for generously giving your time today. I think that for all of us, this is one of the most impactful webinars that Fair Warning has had, and giving real actionable information to really the industry today. So thank you again for participating, and that'll be it.
Great. Thank you, Brian, and this is Shane, and I do want to reiterate the thank you to everyone who participated, as well as the folks who registered and attended. We are well beyond the 60 minutes we normally end with, but as Brian said, the content was so rich. As with all of our webinars, everyone who registered, as well as all those who registered and attended, you will receive the full replay, as well as all of the materials presented today within 24 hours of the beginning of this webinar. So 24 hours from now, you'll have it in your inbox. Should you need any more information or have any questions, please reach out to any of your contacts here at Fair Warning. You can find us at www.fairwarning.com. And again, thank you for attending this webinar. We look forward to hosting you on part 2 tomorrow, and hopefully everyone has a wonderful day. Thank you.